All right, this is Mr. McMurray, and we're here for part 3, hopefully the final part of the female reproductive notes. All right, we're talking about the fluid sac around the fetus. So you have the placenta, which has things from the baby and things from the mother where they can exchange blood. They have the chorionic villi, which are like little fingers that interlock, and things can go back and forth across that one. Okay, diseases can possibly be passed through there, drugs and alcohol can be passed through there. So in a very real sense, a lot of things that the mother does can pass to the baby and vice versa. So that's why when a pregnant mother has to be careful. There's a lot of things that says if you're pregnant, you shouldn't use this medicine, you shouldn't drink, shouldn't smoke, shouldn't all these other things. Good things, though, also antibodies and stuff like that sometimes can be shared across the placenta. Now, the fluid sac around inside, once you got the placenta, then around the baby, there's a fluid sac. We talked to the first of the year about how water is used to cushion things, and one of those is amniotic fluid, which is the fluid in the sac. The sac is called the amnion, and the fluid is the amniotic fluid, okay? And this is connected to the placenta by the umbilical cord. All right, and after the baby is born, the placenta and stuff will come after it, and that is the something called the afterbirth. And basically, it just means the placenta and the endometrium and all the associated things that come with that. All right. Now, a couple terms. First of all, when the egg is first fertilized, we said up here the fertilized egg is called a zygote. After it begins to develop, after that, it is called an embryo. Okay, up until about 8 weeks. By about 8 weeks, almost all the systems are formed, even though they may be fairly primitive yet. You've got the circulatory system and the different systems. And after that, it is called the fetus. Now, technically, there's no magic thing that happens at the ninth week that all of a sudden now it becomes something different. It's the same thing. It's just the same embryo. Ever since it's been a fertilized egg, it's been developing. But after that, we refer to it as a fetus, okay? And then, of course, once it's born, it is an infant. And so just so you know, embryo and fetus, that's really the main difference. It's just how far along is it in the development. All right. Now, that kind of talks about it from the baby's point of view. Let's look at it from the mother's point of view, which is pregnancy. All right, some things of that. One, you have these elevated hormones, all this estrogen and various things that are causing the placenta to form and the uterus to get ready for the baby and all this. When you have those new surge of hormones, very often it can cause nausea, and usually it's felt strongest when the woman first gets up, so it's called morning sickness, okay? It can last all day long in some cases. Women don't seem to have a lot of morning sickness. It just kind of depends on the person. Some are lucky, some are not, I guess. But that's because the new hormone levels can cause us nausea and stuff. All right, another hormone that's released is called relaxin. All right, sounds like a good hormone to have. We're just relaxing, okay? All right, so it basically relaxes, surprise, surprise, the hips, all right, and allows them to widen, okay, which will come in useful during childbirth. So it allows a little more flexibility in there and for the baby to come through during childbirth. But it also causes women sometimes kind of a waddling gait, kind of like they're just got off a horse, kind of bow-legged a little bit and kind of walking, swaying from side to side. And that's basically because of this change in the hip and the hip muscles being relaxed. All right. Now, since you have the fetus, and eventually it will get up to your xiphoid process right here, the woman's xiphoid process. So it's got a lot of weight in front. So that tends to pull and messes up with your center of gravity because you're no longer balanced like you normally would. And one of the things that women do a lot of times is lean back kind of to help center the weight of the fetus over their legs. And so you have this curvature in your back, lordosis, we talked about before. So you're arching backwards, and that makes that lower part of your back bend even more. And very often that causes back aches and things like that. A lot of times you'll see women kind of leaning back with their hands on their hips, and this is kind of trying to adjust that weight. And so it can cause a lot of back pain and stuff like that. Besides that, ignore this line down here for a little bit, but it can cause heartburn because as the baby pushes up against the stomach, it's going to push, you have more acid reflux type thing being pushed up into your esophagus possibly, so you get more heartburn, especially when you're laying down. It's also putting pressure on your intestines, so you may get constipated because it's difficult for the food to move freely through the intestines because you have this extra weight on it. Obviously, your urinary bladder, okay, first of all, has more urine than normal because it has a lot from the baby as well as the waste product, the normal urine that it would have. you have a baby sitting on top of it, so that puts even more pressure on it. Okay, and you tend to have more fluids in your blood while you're pregnant, and so there's going to be more fluids going into your urine. And once again, so that's why a lot of times it seems like women that are pregnant feel like they're going to the restroom all the time. Okay, all that has to do with the weight of the baby. Okay, because now you've got this big 8, 9, 10-pound baby in there, and obviously it's going to put pressure and things on the other organs. All right. The blood volume increases by about 20 to 40%. Okay, so you actually have more blood. Part of this is probably because of you got the blood going to the baby and stuff, so you want your blood to be able to handle it. But also, some people suggest that when the baby is born, the placenta comes out, and along with the blood vessels, so there's a certain amount of blood loss with that. And having this higher volume of blood means that even if you do lose blood during the pregnancy from the placenta and so forth, you would still have enough blood pressure that the blood pressure of the mother would not drop. So that's probably part of why that happens. All right, and oops, there we go. Whoops. All right. High estrogen levels. Okay, as I said, you get these high estrogen levels, and sometimes they will form oxytocin receptors in the myometrium. Okay, and the myometrium will start to twitch or start to do small contractions, okay? And this is just kind of a reaction to the high estrogen levels. And if you do that, you get what are called Braxton Hicks contractions or false labor. False labor just meaning it feels like you're going into labor, you have contractions. A lot of times they will go to the hospital even because they feel very convincing, feel much the same. Sometimes it'll be just small ones that they feel, oh, that doesn't feel like the real thing. But at any rate, those are very common because of the high estrogen levels cause that to happen sometimes. Now, eventually the fetus will produce oxytocin. Remember we said oxytocin is the hormone that will cause contraction to start. So it's really controlled by the fetus, okay? And so when the fetus reaches a certain point, it will begin producing oxytocin, okay? That will also cause the placenta to release chemicals called prostaglandins, okay? And together these are going to trigger the actual labor, okay? Now, of concern is the baby head first or is it buttocks or feet first, okay? And it could be somewhere in between, but usually it's one end or the other because of the shape, the long and oval shape of the body. It's going to be more upright. If it was sideways, then it would not fit very well, and it would also cause a lot of problems. Now, head first is the preferred position. It's easier delivery. First of all, if the head comes through, it's the largest part of the baby, and once it comes through, the rest of the body usually comes out fairly easy. If there's difficulty with the baby coming through head first, it's usually the head that is the problem, because for a baby, the head is much larger compared to the rest of the body than it would be for any other stage in your life. Babies are a large percentage of them is their head. All right, so, and once the head comes through, then the arms are going to be pushed back against the body when they come through, and the legs are going to be pushed back together as the baby comes out. However, if it's the other way around, and now you got these feet first, or the rear first, a lot of times the legs tend to stick out, get caught on things and stuff like that, and the same thing with your legs, the arms come through. So it's very difficult sometimes to deliver a baby that is breech, okay? And also, if it comes out head first, as the baby is being delivered, this is also tearing up the placenta, so there is not getting as the oxygen that would normally be getting from the mom. So the head comes out first, they can clear away the mouth. Even if the rest of the body has difficulty coming out, at least they can clear the mouth and the baby can breathe and have plenty of oxygen and stuff while it's being born, okay? And so that's good. If the head comes out first, they can already be started to breathe before it's even actually delivered. Make sure it's getting plenty of oxygen. Now, if it's a breech, very often they will have to go and do a cesarean where they just cut through the abdomen wall and they cut through the uterus and actually take the baby out of the uterus, and then they have to sew all of that back up. The plus side is you don't have all the contractions, labor pains, etc. If, for example, you have a fairly small woman but she has a large baby, they may plan on doing that in the first place, okay? But oftentimes breech will cause them to have to do that. Now, the woman's going to have to stay in the hospital longer because you can't walk around and stuff until the abdomen incision and the uterine incision cut has healed and can take the pressure and stuff that would be on it from doing that. So it takes more recovery time, whereas if you have a normal delivery, you usually are going to be going home probably the next day. Okay, so there's some pluses and minuses, but obviously some people, for various reasons, are going to have a C-section at the beginning if they think there may be problems. All right, Last thing is dystocia. Dystocia is anything that causes inadequate oxygen to the baby, okay? If it's not getting things. A lot of times the umbilical cord can get wrapped around an arm or leg or something, or somehow gets kinked, and you don't get enough oxygen, blood going to the baby, so of course it's not getting enough oxygen. Various things like this can happen if the placenta would again tear away early, and therefore it's not getting the exchange of oxygen it needs. Anything that causes that is called dystocia. Dystocia. Excuse me. And once again, you might do a C-section in order to, which is where you just cut through the stomach and the uterus to get the baby out and make sure that it can have enough oxygen to breathe and so forth. All right. And that is basically all the notes. So you need to study the 2 pictures that we labeled, and you need to study all these notes that we've taken and be ready for the quiz. And shortly thereafter, we're going to have a reproduction urinary test. So you need to be ready for that. All right. Have a great day, and we will see you later.